New Orleans certainly has been one of America's coronavirus hotspots, but during today's White House task force briefing, Dr. Deborah Birx highlighted the city's large decrease in cases. Listen to this.
You can see clearly in New Orleans about a month ago, very low levels, probably less than 50 cases, large peak and spike around the beginning of April, and they have come down, and they have down to very few cases again.
Joining us now, Senator Bill Cassidy from Louisiana. Senator, thank you so much for joining us. I know you got a lot going on. We appreciate the time. As you heard, the president is going after largely Democratic governors for, in his words, getting carried away with social distancing restrictions. He's blaming them for testing shortages. Why do you think he's attacking these governors right now instead of using his powers as president at these briefings to try to bring the country together and avoid all the partisanship?
I can't speak for the president. I know that he's had a good, close working relationship with my Democratic governor, and who I think has done a good job in terms of encouraging people to stay at home. On the other hand, I really think, Wolf, we have to look how to go forward. There is a mismatch between the people ordering tests and the amount of tests there are. There are capacity that is unused, but there are people who need to be tested. I would say if we're concerned in New Orleans or elsewhere about a racial disparity between people who are getting sick and dying versus not, why don't we go into neighborhoods that we can highlight, knowing they have a high degree of risk factors, diabetes, high blood pressure, diabetes, proactively screen people, fill up all those testing trays, and in the meantime, if somebody is testing positive, quarantine them to protect everybody else. We need to be proactive. Social distancing has helped. Now we need to go to the next step.
Yeah, and you speak with some medical you're a physician, you're a doctor, so you understand these things very well. The president, as you heard, is also continuing to encourage people at these protests, to protest the stay-at-home measures. Do you believe, you're a physician, you're also a senator, that jeopardizes the work that a lot of people are doing in your state and other states to flatten the curve and keep, out of an abundance of caution, these social distancing measures in place?
So clearly social distancing has helped, but clearly there are people getting restless. One fellow called me, I don't care what the president says, I don't care what the governor says, I'm going out. So I think we need to start applying science. If we know that there is a neighborhood that is at high risk because there's cases being identified there, we need to proactively screen. If there's a neighborhood in where it's nothing happening, we can be a little bit more, shall we say, tolerant of people having interaction. Because people are going to, if they don't see a scientific rationale, they are going to rebel. Let's give them a scientific rationale by doing the proactive testing to say, oh, you're good? Not so good. It's not perfect, but people are getting restless. I think this is a way to address the restlessness.
In Louisiana right now, New Orleans specifically, do you have enough testing equipment?
So I'm told by people running the test, so the trays will come like 200 in a tray. They're running like 170 in a 200 tray. That's 30 slots that are missing. In some cases, it's even more. That's why I think we need to start proactively finding where to test, going into neighborhoods, screening people, and fill up those trays, but also proactively identify people who are at risk. That's how we continue to flatten the curve, decrease transmission, but allow a little bit more freedom in the economy.
There was some major news today that broke. Multiple health officials, Senator, now telling CNN that it was contamination in one of the manufacturing sites at the CDC. The test for the coronavirus was ongoing at that time, and that contamination caused weeks of delay, slowing the U.S. response to the pandemic. What's your reaction to that?
Well, there's going to be, if you will, an analysis afterwards. In medicine, we'd call it a postmortem. Let's figure out what went wrong. Right now, I think, though, it's more important to go forward. Yes, mistakes were made. But on the other hand, what is a plan going forward that flattens the curve, increases economic freedom, and saves lives? That's where I think we need to focus.
New Orleans certainly right now, based on the numbers that we see, is trending in the right direction. But your governor, John Bel Edwards, said the state overall is not ready for a phase 1 reopening plan. The president issued phase 1, phase 2, phase 3. Do you agree with his approach?
Now, so what I was told, and I've not read it directly, that our governor is going to begin to allow medical offices to open for things like elective surgeries. I think that's a great idea. Dentists and physicians are used to wearing masks, having universal precautions. They will set the example for the rest of society, disinfecting chairs after people come in and sit and then go back to the exam room. So my understanding is that is the way we are progressing. I actually think that's a reasonable way to do so.
I know it's really important to go to the dentist and go get examined at your doctor's office, but I suspect a lot of people are going to be nervous about doing that right now.
I suppose, but for example, the gastroenterologist, I'm a gastroenterologist, I'm going to speak like one. He goes, the patient calls me up and he's having blood in his bowel movement. Now, it's not a lot of blood and it's not an emergency, but it's not really elective. This is something that I think we should look at sooner. Someone else told me my wife has a skin cancer, needs to be cut off. Not emergent, but not really elective. We would like to get it done. She's going to walk in. They're going to be Lysol wiping down the entire place she's going to lie. Everybody's going to be wearing a mask and a shield. She will be reassured, but her skin cancer will be removed. I think that is the way to begin to reopen.
Yeah, well, these are really important measures, and we're grateful to you, as always, Senator Cassidy, for joining us. We'll continue this conversation down the road. Thanks very much.
Thank you, Wolf.